Hi, I'm Dr. Ron Kurzeka, and today's topic is choking and CPR. The key things you need to know about choking and CPR include things such as how to open airway in a child and how to perform CPR. So let's talk first about how to open the airway in a child. If you find that a child is found with no breathing or trouble breathing, you need to be able to open that airway. And if you look in these diagrams, we show how to open the airway in three age groups. The first is an infant, age 1 or less. The next one is a child between 1 and 8. And then the third is a child from 8 to adult. So notice in the child who is an infant that the way to open the airway is by just tilting the head to what's called a neutral position. So when you look at the child's nose and forehead, that a line drawn between the tip of the nose and the forehead is actually horizontal. That's the best position to open the airway in an infant. A child between the age of 1 and 8 needs to have the head tilted just slightly in extension or tilted back just slightly. This will open the airway in a child between the ages of 1 and 8. In a child who's 8 to a teenager, you open the airway by extending the head and neck more. This will enable air to pass more easily through the airway. The next thing you need to know is how to do CPR. And the key thing about doing CPR in an infant is knowing that the location is 1 finger's width below the nipple line. So if you draw a line between the 2 nipples, 1 finger's breadth below that, you put 2 fingers and you press for about 3/4 of an inch, and you do 100 times a minute with 2 ventilations for every 30 compressions. So again, for an infant, it's 1 finger below the nipple line with 2 fingers doing compressions. For a child between the age of 1 and 8, the method of CPR is with the heel of your hand on the sternum and using 1 hand to do CPR, and again at a rate of 100 per minute with the heel of 1 hand. In a child 8 and older, you're going to interlock the 2 hands and again do CPR with the heel of your hand over the sternum, doing CPR at a rate of 100 per minute. And again, the rate of ventilations is 2 ventilations for every 30 compressions. So know how to do CPR, and certainly one of the best things to do is take a class to do CPR so that you're certified in managing a child's airway and a child who is choking. And let's talk about choking for a minute. One of the key things to know about choking is how to get the object dislodged. And if the child is between the ages or is under the age of 1, the best thing to do is to do 4 quick back blows on the back of the chest. And then what we're going to do is turn the child over and we're going to do 4 chest thrusts. So keep in mind 4 back blows first, and I can demonstrate on this child right here. What we're going to do is 4 chest thrusts, hard and quick into the back of the chest. And then when we do the chest thrust, we're going to move a finger below the nipple line and do 4 quick chest thrusts right on the sternum with 2 fingers. So in a child between the age of 1 and 8, or between 1 and adult, I should say, what we're going to do is do the abdominal thrusts, in which you take your hand, you're going to surround the child, and as in this photo here shows, you're going to use the end of 1 hand and push it into the child's upper abdomen and do that quickly 4 times. This is also called a Heimlich Maneuver, and you're going to try to dislodge the object by doing 4 quick upward thrusts. See if it's dislodged, and then try again with 4 quick upward thrusts. And you have to do it kind of forcefully and quickly to try to dislodge the object. Actually, what you're doing is you're pushing air up from the diaphragm and causing the object to be pushed out. So thank you for watching. My name is Dr. Ron Kurzeka.